Most of my male patients don't look at their poop. They have no idea what it looks like, and they rely on their female partners in the room to answer the questions about what their poop looks like. It's ridiculous. It's ridiculous.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week's episode is titled Crappy Conversations That Matter, talking all things GI with Doctor Shida, Haghighat. Dr. Shida is a gastroenterologist at UCLA Health who has been using humor to educate and inform her patients and viewers on social media about their GI health. So, Dr. Shida, thank you so much for joining us here on the Man Up Podcast.
Thank you so much for having me. I'm so excited to be here.
We're very excited to have you and talk a little shit today. So it'll be a very great.
Oh, you're thinking about that the whole time, huh?
I've had that in my chamber, dude. Well, go ahead.
You know, they call me I like to tell people I'm a shit doctor, but then I like to follow it up with, no, really, I'm a gastroenterologist. I'm a shit doctor. Thank you for that pity laugh. A lot when I do stand up, a lot of people in the crowd don't love it, but so thank you for the pity laugh.
No, that was good.
I enjoyed that.
Listen, you're shit. We're pissed. It all makes sense. It's all good here, right? So let's get right into it. So when we're talking about shit, bowel movements. Why should we care about our bowel movements? Do our bowel movements really matter in the big scheme of things?
I am so happy you are addressing this issue on a men's health podcast, honestly, because most of my male patients don't look at their poop. They have no idea what it looks like, and they rely on their female partners in the room to answer the questions about what their poop looks like. It's it's ridiculous. It's ridiculous. I'm always like, so what color are your stools? And they're like, honey, you know that one. And I'm like, you don't know the color of your stools? So if I'm going to get anything across today, it's that it's very important to turn around and look at your stools before you flush them down the toilet. Why is it so important? Because it can tell you a lot about what's going on in your body. It can tell you if you have an infection, if you're absorbing things correctly, if you can have cancer. There's a lot of reasons why it's important to look at your stool. It tells you a lot about what's going on inside of your body and the status of the health of your body.
So we don't know shit about shit, right? We're not looking at our shit. We don't give a shit about shit is basically what I'm trying to say, men. And
Justin, do you look at your poop? I look at my poop.
I absolutely look at my poop. I'm on the same page as you, but I think that we have a medical background. So
That's true.
we went through med school learning about like the Bristol scale and all that stuff. So, I think we do think about it more consciously. But I think, what percentage of patients in male population would you say actually look at their poop when you ask, Shida?
I would say about it's patients who are older than 50. Men who are older than 50 don't really look, I would say. And it's the majority of them. It's the younger men who come into my practice who are very acutely aware of what their stools look like. And so I would say it's more the older than 50 population.
Gotcha. Now, the most common thought process that goes through a guy's head is like, when should I be concerned about what my, poop looks like, or bowel movements have kind of gone, awry. So what are the things that guys should pay attention to? So
number one, you have to pay attention to whether there is a change in bowel habits. Now, if you're used to having 3 soft stools a day for the last 20 years, that's your baseline. But if there's suddenly a change where you're having hard, rocky stools once every other day, that's considered a change in bowel habits. Or vice versa. If you're having, you're used to having 1 bowel movement every 2 days, and all of a sudden you're having 3 episodes of diarrhea daily, that's a change in bowel habits. So a change in bowel habits, one. And then you should be concerned if there's a change in color. Black stools can mean that you're bleeding somewhere from the upper GI tract. You could be having an ulcer. Maybe if you're taking too many NSAIDs or like Aleve, ibuprofen, naproxen, that can cause an ulcer, that can cause slow bleed from your stomach, that can cause black stools. I can't tell you how many patients I've had who come in and say, yeah, I've been having black stools for like 2 weeks now. I didn't think it was an issue, or more than that. When else should you be concerned? I think you should be concerned if there is persistent red blood coming from your rectum. If there's red blood, maybe a speck on the toilet paper here and there, then that's not as concerning. But if there's persistent red blood, so change in bowel habits, change in color, change in consistency, this is when you should be concerned.
That makes a lot of sense. I mean, I think being regular in anything for our health is probably a good thing. And when that changes, that's always a sign. One thing you did mention there is black stools. And I think one thing that I learned maybe the hard way when I thought I was dying one time was what Pepto-Bismol does to our stools. So can you just highlight to our listeners what taking Pepto-Bismol does to our poop?
So everybody needs to know this. In fact, they should put this on the back of the bottle. Pepto-Bismol causes black stools 10 out of 10 times. I can't tell you how many phone calls I've had to field, emergency phone calls I've had to field, where patients think they're bleeding out, dying. And I'm like, did you take Pepto-Bismol? They're like, yeah. And I'm like, you're good. I'm going to get off the phone with you now.
Kev, you ever do that?
No.
Damn, I guess take a Pepto-Bismol a decent amount then.
While we're on the topic, another thing that can cause black stools that a lot of people actually don't know is that iron supplements can cause black stools. Iron supplements can also cause constipation. So before you jump the gun to go seek care, if you're having a change in bowel habits, it's good to kind of think about, hey, did I start any new medications recently that could cause a change in my bowel habits? So iron supplements is a big one.
Good.
So before we keep going, Shida, can you see Justin or no?
No, Justin is gone.
Yeah. Okay.
I went away.
I want to stop it. I'm going to stop it right now for a second. I know you kind of touched on it where you're saying like, you know, if you have 3 soft poops a day or you have just like, 1 poop a day, but is there like a set number or a standard of how many times a day that someone should be pooping?
I will say it loud and say it proud right now. There is no set number of how many times a day one should be having a bowel movement. Regular is whatever is your baseline. So you could be having 1 bowel movement every 2 to 3 days or 3 to 4 bowel movements every day. Both people there's no issues. There's no problem with either person.
Asking for a friend. What about like 7?
7 bowel movements a day?
No, it's not.
7 a day?
Yeah.
7.
Is that, what if you have every day 7?
So at that point, I would ask, what is the consistency of those 7 bowel movements?
Say they're good.
What does good mean? Maybe you're just used to watery stools every day and you think that that's good.
Yeah, it's true. So you should probably go get some evaluation.
Are you?
Sounds like your friend does need to get evaluated.
So you're having.
I'm kidding. No, that's not me. I don't have that many.
Yeah, that's totally acceptable. I would take you in my clinic.
All right, thank you. So 7's probably a number you should probably consider that too much.
Again, if they're formed stools, I would say that's totally fine. That's just what your body's doing. But yeah, 7 is a little bit above average.
Okay.
You can consider yourself above average.
Okay, so with this with having bowel movements, obviously a big part of that, and you keep hearing it, and you're hearing it more, is this idea of fiber, right? And it seems, especially in the American diet, that we struggle to really get fiber or sufficient fiber in our diets. So start off, why is fiber important for us in general?
Okay, why is fiber important for us? So Fiber is magical. It does more than just promote the forward movement of your bowel movements. It does more than just make you regular. It also can lower cholesterol. It can regulate blood sugar. Fiber, a lot of people don't know this. So what happens once you ingest fiber? The bacteria in your gut break down the fiber and release short chain fatty acids. Those short chain fatty acids do so many wonderful things for your intestinal microbiome. They decrease inflammation in your gut. They promote the growth of good bacteria in your gut, and they also downregulate the growth of bad bacteria. They do a host of things for the gut microbiome, specifically, like I said, decreasing inflammation. And since a lot of diseases and conditions and cancers have been shown to originate from a dysbiosis in the microbiome, one of the tools that we have to kind of prevent the proliferation of inflammatory diseases and or cancers is by making sure you're eating enough fiber every day.
So I mean, listeners, you heard that. Fiber does some awesome stuff. It decreases inflammation, it gets rid of the bad bacteria, make sure your microbiome is doing well, gets rid of cholesterol. And so a lot of positives with fiber. So I'm sure our listeners, they're bought in. So how much fiber should you be taking every day? And what's like the best way to increase your fiber intake?
Love this question. So the recommended daily intake of fiber should be 25 to 30 grams a day. That probably means nothing to you. Like, you're like, how many grams are in? Like, I don't know how many grams are in. Like, you two were nodding like, yeah, okay, 25 to 30. So yeah, I'm here to like spell it out. Don't worry.
Love it.
So basically, like I said, the recommended allowance of fiber, dietary fiber, should be 25 to 30 grams. Studies have shown that people are getting only like 15, Americans at least, are getting only 15 to 20 grams of fiber in their diet. How can we go about understanding what 25 to 30 grams even means? For example, you'll be hearing me talk about kiwis. One kiwi contains about 2 to 3 grams of fiber. Chia seeds, another very fiber forward product. One serving of chia seeds, which is 3 tablespoons, contains about 10 grams of fiber. Oh. That's amazing. So, and then everything in between.
Well, one thing that I have been really staunchly against is juicing fruits and vegetables because it gets rid of the fiber. Is that true? Am I right there? Like, are we like doing ourselves a disservice when you go to the store and you're buying like grassroot juice or like all these juiced vegetables, these juiced fruit? Because are you getting that fiber or are you losing the fiber? Because this is something that I feel like we're missing out on the nutrients by juicing things off the
Yeah, no, I definitely think you're right. I definitely think you're missing out on a lot of the fiber by juicing fruits and veggies. For example, everything goes back to kiwis for me. Most of the fiber in a kiwi is in the peel, in the outer lining. So you could only imagine how much fiber you're missing out on by just juicing fruits and veggies. Also a question I don't really know the official answer to.
Wait. On the kiwi, the outer lining, you mean the fuzzy part?
The peel. I don't know why the word is escaping me. What is the word for the...
Yeah, the peel, right?
The peel.
The skin?
The skin. Thank you. English was not my first language. I'm sorry.
Yeah. Skin. Yeah. Cause it feels like skin kind of, that I guess.
Yeah. The skin is where most of the fiber is, actually, at least half of the fiber.
Yeah. You can eat. Yeah. In case you didn't know, Kev, you can eat the skin of a kiwi. Like you can just bite it like an apple.
I'm learning things every day. I only eat the inside of the kiwi. I don't eat the outside.
Well, how are your bowel movements, Kevin?
Oh, well, actually mine are
Very
pretty
personal.
good.
They're good?
They're pretty good. Usually I'm open. I'm usually around like 2 to 3 time kind of guy a day, pretty regular formed.
Okay.
That's pretty good. Yeah. I mean, definitely better than 7.
Yeah, I think if I hit the kiwi up, maybe we'll get that, going a little bit more like the skin of the kiwi.
Okay. I see why Justin has more enthusiasm for this topic because he is having 7 bowel movements a day.
That was Justin's friend. That was
my friend. It wasn't me. I was worried about my friend. But so listen. So we understand the importance of fiber now. We understand that we need to increase in our diet, more fruits, more vegetables, chia seed. You love kiwi. You're on socials, pushing kiwi, eating kiwi. For the love of God, please tell us about the kiwi and why we should be eating more kiwi. Not sponsored by kiwi.
Not sponsored by kiwi. So kiwis have both soluble and insoluble fiber. They also have this enzyme called actinidin, which basically breaks down proteins. And it's one of the only fruits. First of all, kiwi is unique in that it's one of the only fruits to have both soluble and insoluble fiber, and also to contain this enzyme called actinidin, which breaks down protein, which promotes better digestion. Why else do I love kiwi? Because for all my constipated girlies and boys out there, kiwi is a natural treatment for constipation. There are lots of studies that show that 2 kiwis a day is just as good as a fiber supplement in treating constipation.
2 kiwis a day keeps the doctor away, just like the apple. The new enemy of the doctor. Very interesting.
Yeah,
I love it.
and so one kiwi, there's golden kiwi, there's green kiwi. Green kiwi has more fiber, but golden kiwi is more tasty and aromatic. And so golden kiwi will have 2 grams of fiber, but if you eat it with the skin, it'll have 3.5 grams of fiber. So boom, that's about 1/5 of your fiber for the day. And then if you add that to a serving of chia seeds, which is 10 grams of fiber, then you're almost basically halfway done with your fiber a day. And
There you got it right there.
That's what I have
It's
for
just
breakfast.
spelled out right there for you.
I have Metamucil every day. Well, the psyllium husk.
Great.
Can you quickly comment about psyllium husk or Metamucil as it's also called? Should everyone be taking that? Or is it something that we should really be considering taking?
Absolutely. So psyllium husk is one of the foremost supplements it's the only supplement that I really recommend for everyone. It is a seed of a plant from India called Plantago ovata. And basically it contains soluble fiber. And what happens is you mix the psyllium husk with water and it forms like this gel-like consistency, which crazy enough, it helps both constipation and diarrhea. It's magic. So if you have diarrhea, it can help with diarrhea. If you have constipation, it helps with constipation. It can also obviously lower cholesterol and help control blood sugar levels. But one main thing about psyllium husk comes in powder form and it comes in capsule form. Okay. Powder form, you pour some into a glass of water. It's kind of a gross, viscous kind of consistency and people don't love drinking it. So they always opt for people love doing easy things, so they take the capsule form. And the capsule form doesn't really do anything. In fact, it makes you more backed up and constipated and bloated.
Are you serious?
Yes. I mean, you have to listen to your gut. You have to listen to what's going on in your body.
Just like, that's why.
I've literally been on the capsules for like 8 years. I transitioned to the capsules.
But how do you respond to them?
I guess good.
Well,
The problem with the powder, it is so disgusting. Like the texture is disgusting. It sits in the cup that you're in. It's hard to get all of it. It's not even about the fasting. Like I will mix stuff in water all the time, but that is just gross.
I know.
And so really, I have to go back to that, is what you're saying.
Well, it all depends. What are we giving you psyllium husk for?
A combination of things. Just regularity, just want to be regular. Not constipation. How about that?
Okay. So if you're telling me where you're taking psyllium husk for not constipation, and I'll use my imagination, then actually the capsules would be good for that. Okay. Most people come to me, most of the time when I prescribe psyllium husk, it's for people with constipation. And so when you give them the capsules, it just sits in your gut and it makes you more backed up and more full and more bloated. If anything, if you're going to take the capsules and you're constipated, just drink a glass of water to begin with. And then you can swallow the psyllium husk capsules and then it'll form that gel amalgamation in your stomach.
That makes
I'm learning
sense.
so much.
More than you ever wanted to know about.
Wait, so let me ask though. So look, I would say maybe sometime like 7 months ago, like I went through a couple days where I felt really constipated. Never really get constipated, and I got like really bad constipation. And so I started taking the psyllium husk. Now, everything went fine. I stopped taking it for a while, but do you think everyone should, incorporate this as like a daily routine kind of thing? If you're having regular bowel movements, like are the benefits being added or no?
If you are not intentionally putting fiber in your diet, like with chia seeds and kiwis, then yes, I think that everybody should be taking a fiber supplement, the psyllium husk supplement. Yeah. But if you think you're getting enough in your diet and your bowel movements are fine, you're happy with how your bowels move, then I don't think that you need the psyllium husk.
But does the capsule work for fiber no matter what, or no? Right. That's my question, right? Because
yes.
Forget about the bowel parts. But
yes.
if you're counting it towards fiber,
yes.
is fiber no matter its form?
It will provide those beneficial effects that I mentioned earlier, regardless. But it might not help your constipation if you're downing capsules.
Got it. So on to the what Kevin was struggling with, constipation. We're kind of talking about this, but it's truly like one of the worst things ever. Everyone hates it. No one cares about diarrhea. Diarrhea sucks, but constipation is truly just a horrendous experience. So we've already talked about it, but what are some things that often you see that are triggering constipation so that you can prepare? Kevin mentioned a trip. I'm sure that's one thing, travel. But what are things that that can cause constipation? Maybe things we can do to prevent those things in those events, and how we can treat constipation in general.
Before I answer that question, I have a few comments. You said that constipation is the worst thing ever.
Yeah.
Now, from what I've learned about you over the last 20 minutes, for people who have kind of like a loose stool baseline, constipation does seem to be like the worst thing ever for them. But for people who are more at baseline constipated, diarrhea is the worst thing ever for them.
Really?
Wow. So I grew up as a constipated girl. I was traumatized by going to the bathroom when I was a little girl. I would go once a week. Is this too much information? I'm just going to give it. I would go once a week, and it would be painful. And I'd have large bowel movements, and they would hurt, and I would sit on the toilet forever. And everywhere I went, I clogged toilets, and it was a problem. And I'd always need to know where the plunger was. So all that to say is this is my favorite topic to talk about.
Amazing.
I have it under control now with the chia seeds and the kiwi.
Congratulations.
Thank you. Thank you. Now, what are some things that can trigger constipation? That was what you asked, right?
Yes.
Okay, tons of things. So common medications can trigger constipation. The most common of them would be antihistamines. Antihistamines cause constipation. And a lot of times patients come to me in clinic and they are complaining of constipation. I'm like, are you taking any meds, any new meds? They're like, no. And I'm like, okay, do you have allergies? They're like, yeah. I'm like, do you take allergy meds? They're like, oh yeah, I took a Zyrtec last night. So, you have to do a little bit of digging. It's not always obvious. So antihistamines, iron supplements cause constipation. A lot of antidepressants can cause constipation. A lot of migraine medications can cause constipation. And that's because of the brain-gut axis. We have more serotonin receptors in our gut than we do in our brain. What are some other common triggers? This is not as pertinent for your male audience, but birth control can cause constipation. The hormone fluctuations in the week before your period can cause constipation.
But what about travel?
Yes, travel.
That is why does travel cause constipation? I don't really get it.
Travel can cause constipation, especially air travel. Flying can dehydrate you and dehydration can cause constipation. Getting out of your normal routine can cause constipation. Personally, every time I travel, I make sure I travel with little Miralax packets. In the 2 days leading up to a trip, I take Miralax 2 days leading up to, and then if it persists as a problem on the trip, I continue to take the Miralax. Fiber for supplements for travel constipation, I haven't found to be as helpful because that's more of a long-term solution. And yeah.
So come prepared. Bring a Miralax. Stay hydrated, stay regular, stay in your routine if you can.
Yes. And another thing that can cause constipation that a lot of people underestimate is stress. Some people's guts respond to stress by having 7 or 8 loose stools a day. Other people's guts respond to stress by just becoming constipated. And so if you notice I don't know what happened to you, Kevin, 6 or 8 months ago. Did you ever figure out why?
I think I went to go hang out with Justin in Miami. So stress, a lot of stress every time that happens. So I'm pretty sure that's what caused the constipation.
Yeah.
I have that effect on people.
All right. This is great. Actually, I think next time I travel, I'm gonna start incorporating that Miralax because sometimes I fear the next travel days because I'm like, oh man, like my bowel movements are gonna be kind of like all awry and
Yeah.
that sucks.
It sucks. It sucks. It makes you not want to eat, and half the right
Yeah.
reason to travel is you want to eat.
Hmm.
So yeah, I would recommend though, don't expect a quick fix with one Miralax dose. It works best if you take it in consecutive days.
Perfect. All right. So, let's transition and talk about bloating. Like a lot of patients always come in, they're like, I'm feeling bloated. So why don't we talk about bloating and small bacterial overgrowth, which is also known as SIBO, small intestinal bacterial overgrowth. So why does it happen and why is it bad?
Yeah. Okay. So, quick question though. Most of the patients that come into my clinic who complain of bloating are women. Do you hear that a lot from your male patients?
I have a lot of guys actually who come in and they get like incidental findings on their CT. Most of them went are like, oh, I was just feeling bloated, not like I feel like abdominal bloating, and that's why I got the CT.
Oh, okay. Okay.
Well, yeah. Another thing is though, like, we do see guys who have urinary issues, and a lot of times, like, they're either bloated, right? The bladder bowel
Yeah.
connection is real. So, like, guys who have constipation, sometimes they can't piss well, or if they're bloated, they really have issues peeing, or they're just struggling in general. So it's all connected. So yeah, I think we do see this a decent amount actually.
Interesting. Okay, so I'm gonna tell you there are 3 or 4 reasons for bloating. One of which is small intestine bacterial overgrowth. So whenever I have a patient with bloating, I kind of go down my algorithm of what could it be. So bloating can be caused by constipation. So if a patient is on the constipated side, we tend to treat the constipation first. If after treating the constipation, they still have the same bloating, we move on. Another reason for bloating can be small intestine bacterial overgrowth, which I will get to, but we'll talk about that. A third reason for bloating can be, hear me out, abdominophrenic dyssynergia, which is basically when the diaphragm and the abdominal muscles do not coordinate correctly when you eat. So basically, if you eat and produce gas, your abdominal cavity cannot accommodate the gas because the diaphragm is not lifting to accommodate all that volume of gas. And that's called abdominophrenic dyssynergia. And that can result in bloating, abdominal pain, and distension. And it's a very difficult thing to treat. We mostly treat it with like diaphragmatic breathing exercises. And so those 3, so I just named 3. And then a 4th reason for bloating, we cannot find the reason, but the way to treat it, yes, bloating is an epidemic, and it's honestly our hardest condition to treat. Bloating. So number 1, constipation. Number 2, SIBO. Number 3, abdominophrenic dyssynergia. Number 4, idiopathic. We don't know what causes it, but how do we treat it? With diet, a low FODMAP diet, which I'll talk about.
Now, quick question before you go into SIBO.
Yeah.
How do we know when we should, how do we define bloating actually? Like, how do I know if I actually have bloating that I should go to a doctor to see?
Yeah. So yeah, that's interesting because the men that come in to see me, they kind of just explain it as like they feel as if they've gained weight and they feel as if their pants don't button anymore. So it's interesting. Different people express it different ways. But how do you know if you have bloating? You would see some abdominal distension. You would basically know. You would be very uncomfortable, and you would seek care. You'd be uncomfortable. Are you bloated?
No, I feel great. I feel good right now. But I'm just asking, because how long should I be concerned? Like, yeah, we all have a meal where we feel bloated after, or we have an event where we feel bloated after. But how long should bloating last before we actually should be concerned?
So the bloating that leads people to the gastroenterologist is when you wake up in the morning and you have a sip of water and you're already bloated. You're bloated after a sip of water, or you're just have abdominal distension after every single meal. How long? I mean, if it goes on for about greater than a month, you can come see me.
Okay, great. Noted.
Okay, SIBO, small intestine bacterial overgrowth. Okay, another difficult topic for gastroenterologists. Why is it difficult? Because when we treat it, because the treatment is antibiotics, about 60% of people have a recurrence of symptoms. So people are constantly in and out of our doors with, hey, my SIBO's back, my SIBO's back, my SIBO's back, my SIBO's back. Patients are frustrated, doctors are frustrated because we don't have good tools. But let's get back to, you probably want a definition of the condition. Small intestine bacterial overgrowth is basically an imbalance of the good and the bad bacteria in your gut, in your small intestine, actually. And who is at risk for SIBO? People who have had intestinal surgeries, intestinal resections, and then some people who have had their stomachs removed. And the stomach is where the acid is produced. And so it's thought that the acidity, so the lack of acid, can contribute to small intestinal bacterial overgrowth. Also, slow motility throughout the gut can contribute to small intestine bacterial overgrowth. That's another risk factor. Let's see. People who have been on multiple antibiotics in the past can lead to small intestine bacterial overgrowth. These are all risk factors for SIBO. Now, how do you test for it? You test for it with a breath test. Okay. So you inhale a carbohydrate like lactulose, or you don't inhale, you ingest, then you would aspirate. You like a carbohydrate like lactulose or glucose, and the gut in your bacteria produce a byproduct. When you breathe out of the breath test, produces a byproduct, either methane or hydrogen. And these gases are not kind of secreted or emitted by our own human cells. Elevated levels of hydrogen or methane will give you a diagnosis of SIBO. Oh, it's such a hard topic to talk about. It's like
Sounds like the urologist like prostatitis.
Yeah, actually, that's a great analogy.
Really,
Just kind of like, well, we kind of ruled a lot of other stuff out, and it keeps coming back, and like it's hard to treat.
For sure. Well, thankfully, we don't have to treat it.
You don't have to treat. Oh, you don't have to treat prostatitis?
No, SIBO.
Oh, yeah. So a really expensive antibiotic called rifaximin is the treatment. And then if the patient comes back with symptoms, then we give them the same antibiotic again. There's also kind of second line antibiotics we can give. But because of the high rate of recurrence, the way we like to prevent recurrence is by giving patients a pro-motility agent, which basically is kind of like a constipation medication that helps move bowels forward throughout the intestines, so that poop isn't just sitting there in your gut causing the dysbiosis. And another tool we like to use to treat SIBO and bloating for no reason is a low FODMAP diet. Have you guys heard of this?
No
A low
idea.
what?
A low FODMAP. FODMAP is a fancy acronym for a fermentable starch, fermentable oligodimonoaminosaccharide.
Okay.
Kimchi?
Kimchi, cabbage, that's high in, so that's a high FODMAP food. So
Hell yeah.
the best way to treat bloating is this diet. Basically, you avoid foods that are high in fermentable starches, such as, ready? Brussels sprouts, asparagus, cauliflower, garlic, onion, apples, tons of other fruits and vegetables I'm not mentioning, but it's worth a Google. These foods are high FODMAP foods that contribute to bloating. And when patients go on most patients, when they go on the low FODMAP food diet, they feel better. Another way we treat bloating is by giving digestive enzymes, over-the-counter digestive enzymes. Yeah, but that gets complicated.
Yeah, we'll get into that.
Yeah,
But
okay.
we'll definitely talk about over-the-counter stuff in a second.
All right, let's shift gears from SIBO. SIBO sounds, that's
It's terrible.
I just hope people don't get SIBO. But okay, so look, I was perusing your social media and I see this picture of actually, I'm not going to name specific brands, but I see all the beef jerky, all that stuff. And then you say this is the cancer house. So let's shift gears. We're getting out of SIBO. We're going to talk about smoked meats. All right.
Yes.
Now look, Justin eats a ton of beef jerky. He loves that stuff. I maybe eat it once in a blue moon. I've never really loved it, but it's a high protein snack. We know that. It's got good protein. It's packed in there, and it's easy to eat while you're on the go. But again, on your social media, you said this is like the cancer house. So why should people be avoiding these?
So many reasons. Okay, so now that we know that Justin is eating beef jerky every day, I think we have a reason for his...
Not every day, a lot of days though.
What? Oh, you can't name brands. Okay.
Well, I can
You can
name
name
it. I love Chomps, man.
Okay.
Shout out to Chomps, one of my favorite companies. Yeah,
We'll
they
talk
sent
about
me some sticks. I love their beef sticks. Shout
we'll
out to them.
we know you like beef sticks. We'll talk about okay, my lighting is it's dark in here. Beef jerky is a processed meat. Processed meats have been labeled by the World Health Organization as class 1 carcinogens. That's bad.
I think that's a bad thing.
That's bad. So processed meats, of which beef jerky is one. Why are processed meats bad for you? So the process by which meats become processed, they become they're dried, they're smoked, they're processed, and then what else happens? And then they all these additives are added to extend their shelf life and make them taste good. All of these things can produce cancer causing. Also, kind of smoking the meats for extended periods of time at high temperatures produces carcinogens. I think it's PAH. I'm going to mess it up, so it produces carcinogens that can both damage the DNA and contribute to cancer formation. So what are processed meats that I'm kind of alluding to? Beef jerky, bacon, sausage, hot dog, salami, turkey meats, bologna. Yeah. I know my entire childhood, like all those Lunchables. I know.
Lunchables.
Yeah.
Lunchable is, we'll get to Lunchables later.
My bologna has a first name. It's Cancer.
Yeah. It's funny. I didn't know you named your bologna. Okay. So, all right. What did I want to say?
So no smoked meats, like not at all.
Listen, you can dabble once in a while, but don't be walking around chomping on beef jerky every day as your main protein source.
Yeah, it's just really quick, easy to get, high protein, low calorie. I get it. I do. But what if here's an honest question though. Is it because you're going to a company to process it? Say I bought an actual beef jerky smoker thing in my apartment, which exists, like these meat dryers. Is that an okay alternative, or it really is?
Yeah, I think that would be an okay alternative. But like I said, those like the smoking and cooking them at high temperatures can alter the content in them to kind of alter our DNA.
Yeah, I mean, Japanese people have a higher risk of stomach cancer. We always learn that because they have a lot of smoked fish, right? Mm-hmm. That's like one of the known things that we all learned in medical school for sure. So yeah, it's real. It's not like it's fake, but it stinks to hear because I do love it.
Well, I mean, listen, you don't have to cut it out entirely. Just maybe like once every 2 weeks, not once a day.
Justin's reevaluating everything. He's taking capsules every day. He's eating beef jerky every day. He's just like, the fuck am I doing?
I'm having an existential crisis on my bowel movement.
I didn't realize I was going to learn so much about Justin during this.
Every episode, always.
Yeah, I'm learning a lot about myself today too. Don't worry.
So
listen.
A lot of people ask me about Chomps because Chomps they claim that they are the healthy alternative for beef jerky because they don't have any nitrite or added nitrite or nitrates, and they don't have any added preservatives. So I'll say if you have a beef jerky addiction, sure, go for the Chomps, but don't eat it all the time.
That's not still processed. Would like to be sponsored.
It's still processed. That exactly. Kevin knows what's up. Kevin, you're my friend.
I do love Chomp, so shout out to them.
So we're chatting about all this stuff, and I think the one thing we haven't talked about is like what I'll be honest, I'm like fucking scared of is colon cancer. Right? You just start hearing about so many people younger and younger getting diagnosed with colon cancer. Some of it like really fucking bad.
Yeah.
So are there things that we should be paying attention to in terms of like symptom wise that can kind of clue us in?
Yeah. Can I give you just a little statistic on the early onset colon cancer? Colon cancer has been rising in the young adult population in patients between 40 and 49. Colon cancer screening before 2020, we used to start colon cancer screening at age 50. But since there's been so much colon cancer in young adults, we start at 45 now. But I'm glad you asked about this because people in their late 30s and mid 30s and late 30s are getting diagnosed. So astute question. What should we be watching out for? Rectal bleeding. And I know I mentioned if you have like a speck of red blood on the toilet paper when you wipe after you have a really hard, difficult bowel movement where you're straining, then that's likely hemorrhoids or a fissure. Now, if that persists and it's happening all the time for greater than a month, then come in. That speck of blood, go seek care. But if you're having, blood pouring out of your rectum after a bowel movement, if you're having kind of like teaspoons and tablespoons noted in the toilet bowl, if you're noticing blood mixed in the stool, these are all reasons for concern that you should come in right away. Other reasons to consider colon cancer, other kind of presenting signs and symptoms of colon cancer is unintentional weight loss, lower abdominal pain in conjunction with the rectal bleeding, sometimes even bloating. I know I don't want to scare you.
Yeah.
But sometimes even bloating. And also change in bowel habits. If you have new onset constipation, new onset diarrhea that lasts greater than 2 weeks, then come in and get evaluated.
It's all good points. And obviously family history also plays a big part of that as well. If they changed it, right? It's 10 years prior to the relative that you have their age for diagnosis. Right. Is that correct?
Good job. Yes. Oh, I'm so impressed with you. Yeah. Do you want to just be a gastroenterologist? I think you're doing great.
Honestly, I'm not kidding. If I didn't go into urology, I would have been a GI doctor. I think
I can see it.
I think the pathophysiology is very interesting. I think all this stuff is very, very interesting, what I'm listening to and what I'm learning. So thank you for that, because I actually have a friend who was recently diagnosed at the age of 34. So,
really?
It's a very scary thing. It's a real thing that we're seeing. So, you have to be careful. You have to be aware. And your diet honestly matters. Your lifestyle matters, and your family history matters. So you need to be aware of all these things. We talk about it a lot with prostate cancer. We talk about all these other things, but, colon cancer is pretty damn common, and it's becoming more common in younger people. So be aware of it. I wanted to just shift gears again to something. Oh, you wanted to say something?
Well, I was going to say one last thing about, I'm sure a lot of people are wondering why is colon cancer becoming diagnosed in younger people. Yeah. There have been many studies, tons of studies. These studies are difficult to conduct, but most of them are retrospective studies. And over again, what's been found is diet is a main contributor, processed meats, red meat, that's important, and ultra processed foods. It's been found that these three things are the main contributors to the development of early onset colon cancer. And ultra processed foods are like packaged foods, like packaged chips, packaged cookies, sugary drinks like ices, basically candies, anything you find at the movie theaters, anything like cereal with dye. All these ultra processed foods are huge contributors to early onset colon cancer. And obesity, smoking, and alcohol. Those have been found throughout all the studies. Then there's some conspiracy theories, but we're not going to get into that.
I mean, you mentioned Lunchables earlier. Like Lunchables, like every single item in there has like one of those bad things you shouldn't eat.
I know. Honestly, I know. That's why I'm worried for myself too.
God damn. Yeah, those were delicious. R.I.P.
They were great.
So yeah, back to this other thing we were talking about before. We mentioned the psyllium husk, but are there other supplements? People love supplements, as you know. We know men love supplements. So are there good supplements that you would recommend other than psyllium husk? We talked about that one. Are there other supplements for bowel improvement or bowel movements or any GI improvements that you recommend?
For your average person walking down the street who has no issues with their gut, no issues with their bowel, I am not going to recommend you anything, not even probiotics, nothing. I don't want you to even look at me. Don't even ask me. Just walk the other way. No, the only supplement I will recommend is psyllium husk, and we already talked about.
All right, so psyllium husk. That's it.
Yes.
But that's going to lead to my next question, though. Why not probiotics? Look, okay. I think I sent an article to Justin or to some of the guys like a year ago about how like the more yogurt you ate, like there was like some sort of correlation. Maybe I'm making this up. Correlation with like decrease or preventative in colon cancer. And I was like kidding around. I was like, I'm going to eat a ton of fucking yogurt now. But yogurts theoretically they carry like the probiotics. So
yeah.
So like I guess unless you're really having some symptoms, you don't really need to like kind of include that into your diet. Right.
That's so okay. This is a hard one. Patients come in on 5 different strains of probiotics, and I try to take them off I peel them off immediately. But let me just tell you, the American Gastroenterology Association has published a guideline in 2020. They looked at all the evidence and they have established that there is no benefit to probiotics for most gastrointestinal conditions. There's only 3 conditions that data has shown probiotics to benefit for. And are you ready? It's for preterm newborns who are underweight to prevent necrotizing enterocolitis. So nothing you and I ever really think about.
We aged out of that one. Okay.
Yes, we aged out of that one. And then a very small subpopulation of patients with ulcerative colitis who have had their colons removed and have a pouch. And if those people are on antibiotics, then those people are the ones that benefit from the probiotics. Otherwise, probiotics have not been shown to do anything. I cannot tell you how many patients come into my clinic with an array of GI symptoms and signs. And they're like, I tried this probiotic, I tried that probiotic, I tried this, nothing helps. I'm like, well, that's because probiotics don't help. And I don't know why they're just.
Can they make it worse though?
Honestly, sometimes to see what is causing someone's symptoms, I take them off of all those supplements and all those probiotics. So I don't know. It can make it worse. It can. You never know what's in them. Sorry. I know.
No. I mean, this is important because I just always see the yogurt, like Kevin says, and also like I see the probiotic pills. Like with probiotics, I'm like, okay, that's cool. Like I mean, like I'm not like inhaling it like Kevin does. The guy eats like a gallon of yogurt a day, but big yogurt guy. I'm a Chomps guy. He's a yogurt guy. But it's interesting. It's really informative because I think in general we all feel the same. Most of this stuff doesn't work. It's pitched because you can buy it over the counter. It's an easy sell for a lot of people. Yeah. We like to try to do things naturally if we can, but most of this stuff, A, it's not FDA regulated. B, there's really no data supporting that it works, right? And so at the end of the day, people just do it anyway. But it's really interesting that you actually, because oftentimes, when we counsel patients on these things, it's like, there's probably not a benefit. If you really want to do it, you can maybe do it because it's going to cost you money, but it's kind of different for you. You're like, we got to take this crap out of you because it can actually, we got to figure out what's going on. So it's just an interesting perspective.
Totally. Thank you for understanding.
Yeah. And then, I think this is going to be the last question here, but this is a very important one that we continue to see. I think it started in the 90s, maybe even earlier than that. This idea of detoxes, right? There's gut detoxes, there's liver detoxes, whether it's just drinking some product or eating some kind of food. This idea of detoxing your gut or redoing your gut biome or your liver biome and detoxing. Are detoxes real? Do they do anything? Do they provide value? And can they actually hurt you in any way?
Big deep breath. I'm always confused when I walk down the supplement aisle at health stores and I see all these liver detox supplements and I'm just shaking my head. I'm like, why? Who? Why? What is the purpose of this? There's no reason for it. And also there is no evidence to back up there's no evidence to support any sort of liver detox. It's maddening. There's nothing to do there's nothing you can do to support the health of your liver. I misspoke. The only thing you can do to support the health of your liver is exercise, eat clean, avoid processed foods, and minimize your alcohol intake. This is your liver detox. All these liver detoxes sold over the counter. They're not FDA regulated. And some of them can even cause liver injury, which is the funniest part. It's not funny, but Now, gut detoxes, there's no data to support gut detoxes either. But I will say anecdotally, and a lot of my colleagues will agree, when we give patients the bowel prep before colonoscopy, and they're shitting out everything that's inside of them. They're cleansing their whole gut. After it kind of resets their gut, and they the colonoscopy will be normal. We won't find any findings, and they'll say that they actually feel better after their symptoms are all gone after the colonoscopy. Because part of it might be that maybe there was some sort of a reset in the gut, but part of it is partially maybe placebo effect, and maybe they're pacified by the fact that their colonoscopy was normal. So I'm sorry, this is not sexy or exciting, but no, there's no data to support gut detoxes or liver detoxes.
I did one back in college, fell for that.
Yeah. What'd you do?
A couple, so one of friends came up, was like, "Yo, you ever hear of this thing called Nira?" I was like, "Nah." But Nira is this like Indian like herbal, like you drink lemon cayenne for like fucking week, and that's it. You eat nothing else. I think I lasted like a day and a half. I started having chills. Went out and got a fucking burger that night, and I felt great.
Yeah.
Like, I didn't last that long on that thing, but I tried it for a day.
Did you? Oh, that sounds terrible.
It's like lemon cayenne. You're just like drinking that. That's it. You can't eat anything else. Can't drink anything else.
It just doesn't make sense. None of it really makes sense when you think about it. It's just like, also, the liver is the detox. It is literally, its job is to detox the body. Like, how can you detox the detoxer? Like, it makes no sense.
Exactly.
That's literally the job.
Minimize your alcohol and weight loss. That's how to support the detox machine of your body.
Yeah. So it's just a really crazy idea, but unfortunately, people are going to continue to do them. They have these beliefs, and it is what it is. But I think we need to make sure that people don't waste their time, waste their money, and waste feeling like Kevin did with the cayenne crap stuff that was going on in his body. See, we learned a lot about ourselves today, a lot. So this was a really great interview. I learned a lot. I think I'm going to have the best bowel movements ever now. Kevin's going to have better bowel movements now. Yeah. So I'm decreasing so basically what I'm getting is I'm decreasing the beef jerky, increasing the yogurt on Kevin's end. No, I'm just kidding. No yogurt. No yogurt. Kevin's decreasing the yogurt, and we're going to be better here. Psyllium husk.
What are you doing?
I think I'm going to go get the powder now, which is devastating to me.
Yeah, but if you we talked about it. If you're one of those people with 7 bowel movements a day, maybe the capsules might be doing.
That's my friend. That's my friend. I'm crying.
This is great.
All right. Well, thank you so much, Shida, for coming on. Can you tell our listeners where they can find you?
Yeah. Hey, listeners, you can find me on TikTok and Instagram under Doctor Shida. You can find me at UCLA. Just Google me at UCLA. You can make an appointment.
All right, great. So thank you so much for coming on. We'll definitely have you back on because this was fun. I do think we need to do a deep dive in colon cancer, and that's why we kind of like left it aside. But I think that we would love to have you on again to talk about that. I think that would be really important.
I love it. I love it. I love to talk about colon cancer.
All right, great. So as always, thanks to our listeners. Follow, subscribe at The Man Up Pod on all socials. Leave a comment, 5 stars as always. And thanks for listening. Until next time, have a good one.